This is Miss R, a 64-year-old female. Miss R was 22 when she got married and was married for 30 years. Now she is widowed and lives by herself. She has 2 children. One daughter lives in Albany, New York. Miss R loves to visit her daughter in New York because then she can visit her 4 grandchildren, ages 11, 9, 7, and 5. She does this very often because it is her favorite hobby and she loves them very much. Another hobby she loves is scrapbooking the pictures her daughter sends to her of her grandchildren. Every Wednesday she meets with her girlfriends to do this. She lives in a big house by herself and it is becoming too much for her. She needs assistance to take care of it now. She used to be a school nurse at an elementary school. She retired 3 years ago. She says she is basically a vegetarian her whole life and recently has modified her diet because of her eating issues. She craves kosher pickles and loves grapefruit because she can eat it and then drink the juice afterwards. She first realized something was wrong when she was grocery shopping one day and got sick. She started to lose her appetite and her body could only handle soft foods such as mashed potatoes, oatmeal, and mac and cheese. She also began to lose her taste buds. She had continued weight loss and loss of appetite for a month before she realized she needed to go get her symptoms checked out by a doctor. For a week before she went to the hospital, she hadn't eaten at all. When admitted, the doctors checked to see whether the cause of her symptoms were from ovarian cancer or pancreatic cancer. They found a cyst on her ovary and a mass found on her pancreas. They kept doing tests to try and figure out which type of cancer she had. This made her very anxious and overwhelmed. Since she became admitted, she started using sleeping aids. She tries very hard to be optimistic, but is still depressed about the diagnosis. She said, "I gave it one good cry when Roger got here, but you can't keep crying." Roger is one of her close male friends. Objectively, we noticed that she was being very optimistic to the point of misunderstanding what the doctor was saying, and even worse, was in denial of what the doctor was telling her. Despite the diagnosis, she is still confident in caring for herself independently. She has no trouble getting dressed or bathing. She does need some assistance with getting her dressings covered, but says, "I do all my own stuff." She has not had any mobility problems, pain, or dizziness, but she just can't eat. Here is some important medical information on Miss R. She is allergic to Valium. She is on TPN, receiving total nutrition through an IV. She vomits anything from solids to clears and is unable to tolerate anything orally. Her previous surgeries include a large left ovarian cyst, hysterectomy, and a left-sided nephrolithiasis. Initially, she had clay-colored stools, followed with constipation and passing flatus. She is on 2 liters of oxygen and only weighs 111 pounds. Here is a list of Miss R's medications. Propofol, used in preventing nausea. Glucagon through IV, which is a diagnostic aid for radiographic exam of the stomach, duodenum, and small intestine, and used in preventing hypoglycemia. Fentanyl through IV for pain and anxiety. Versed through IV for preoperative sedation. Morphine for severe pain, and subcutaneous injection in the left thigh of Levinox to prevent deep vein thrombosis and pulmonary embolism in surgical and medical patients. Miss R displays signs of hopelessness due to her fear of the unknown because it was not explained to her in a way she could understand. She had anxiety about what the doctor was telling her about her symptoms. Also, because the doctors were doing so many tests on her, She had even more fear of the unknown because they could not figure out exactly what was wrong with her. Here is our nursing care plan for Miss R. Imbalanced nutrition, less than body requirements, related to nausea and vomiting as manifested by patients stating, "I cannot keep my food down." Our short-term goal is to monitor her labs, record her intake and output daily, and take daily weights. Our long-term goal is patient will demonstrate feeding tube care for home use. In our literature review, the journal stressed how the patient needs to remain positive and gain control of herself in the situation. By being positive in a negative situation, it overall helps her well-being and self-concept, which in turn can help her cope with the diagnosis.